Doctors say infection rates of COVID-19 are back to surge level highs here in Jefferson County. However, when it comes to the rate of hospitalizations, well, there may be a silver lining.
I believe we'll probably be moving into the red zone in the next few weeks. We may already be there.
Those are some of the predictions from U of L Health's Chief Medical Officer, Dr. Jason Smith. COVID-19 cases continue to surge across the nation due to variants and their mutations, and Jefferson County is no exception.
We are now at levels that are on par with, if you remember the beginning of the last surge, Omicron surge was sort of end of December and January. We are at those levels today in Louisville, Kentucky, right? We are at very high levels of infection in the community.
Dr. Ted Smith is the director of the U of L Center for Healthy Air, Water, and Soil. He and his team track COVID infection through wastewater from 5 treatment plants across Jefferson County.
We've been doing this for so long. We have very high confidence in the signal that we get from the wastewater corresponding with the amount of cases that we've had in our community. It's tracked virtually perfectly for the entire pandemic.
Many people are now also testing at home.
I think the reason we probably don't have as clarity into the numbers is that people have tests at home and we can go to a drugstore and get a rapid screening test. And that's okay.
Another contributing factor, Derby. Although both doctors say Oaks and Derby festivities can't be to blame for the surge, they say they definitely had their effects on rates.
It is very high. Derby, certainly kept us at our very high levels. I wouldn't say it drove us up any higher, but it certainly didn't help bring levels down either.
One bit of silver lining, however, this surge isn't producing the amount of hospitalizations like others have. Whether that's due to increased immunity or decreased severability, both doctors say only time will tell, as this pandemic is only 2 years old.
2 weeks into all of the other surges, we would see a pretty significant upswing in the number of patients out or coming in with this disease, and we're not seeing that, and that's a good sign.
In Louisville, Ford Sanders, WHAS 11, on your side.
By the way, we also contacted Louisville Metro Public Health today to ask about the Oaks and the Derby, plus all of those parties at local homes. Could that be contributing to the escalating cases? They told us that they cannot pinpoint that event as a cause for a spike in the cases.